Good evening, sir. We are live now. I request your permission to start with the session, sir.
Sure. Please start.
Thank you, sir. Hari Om, everyone. A warm welcome to the 18th session of Iron Anatomy, a lecture series for the first year BMS students. The exclusive sessions will be taken up by the eminent speakers of anatomy across the country for a period of 27 days. We started from 23rd of June and will be running up to the 17th of July. Before starting the session, let me introduce you to Jignasa. Jignasa is a pan-India platform of Ayush fraternity led by the student community of Bharata and was initiated by ABVP in the year 1998. Its motto is Learn Ayush to Practice Ayush. It involves empowering Ayush students from campus to community, bridging the gap between Ayush students and policymakers as well as administrative authorities, connecting every aspect of Ayush including students, academicians, practitioners, scientists, industrialists and hospitals all under one umbrella. Think globally, act locally. In last 2 decades, our efforts were to strengthen the Ayush education system and boost confidence among Ayush students. Jignasa initiated various programs in different parts of the country from the grassroots to international platforms through discussions, study circles, seminars, workshops, and conferences. Let me list a few initiatives undertaken by Jignasa, starting with study circles, lecture series on specific topics, free medical camps, social health status survey, hands-on training workshops, conferences to explore and learn unique aspects of Ayurveda, interaction with eminent Vaidyas and academicians, brainstorming sessions with ICE stalwarts, policymakers, and key stakeholders of ICE systems, National Arogya Expo and International Conference, national level seminars, medicinal plant visits, pharmaceutical visits, agitations for the demands of high student community, private internship program for interested students to learn with acharyas, interaction with traditional healers and visits to explore regional flora, online mock tests, social awareness campaigns on various issues, campaigns for the promotions of various concepts of IS systems for social welfare like Swarna Bindu Prashana Camp, Ashtoshatotari Yoga, Group Surya Namaskara, and various yoga related competitions, and also competitions related to various systems of Ayush. Free healthcare assistance to people through local governing bodies were provided during natural calamities and accidents, and many more such incidents. In our yesterday's sessions, we had more than 800 students joining for the live session and asked their queries regarding the subject and examination. And so far, we have received 13,000 views on our channel for Ayur Anatomy lecture series. We hope to reach as many students as possible who can take maximum benefit out of this. Vidya Nama Narasya Rupamadikam Prachana Guptam Dhanam. We have seen the inability of a common student to afford huge amounts on commercial study platforms despite their jignasa, their burning desire to learn. Jignasa is here to give a helping hand. Learn anatomy with experts, and all we need is your immense interest to learn. Today, we have Dr. Praveen Kumar sir, Professor and HOD, Sri Sri College of Ayurveda, with us for delivering a lecture on cardiovascular system and Indriya Shareera. Sir has completed his BMS from ALN Rao Medical College, Koppa, and MD from SDM College of Ayurveda, Udupi. Sir has a MA from Karnataka State Open University, Mysore, and has done PhD in Shareera Rachana from RGHS, Bengaluru. Sir has also done MSc in Psychology from Jain University. Sir's clinical experience started with as a senior physician in Kerala Ayur Kendra Ayurvedic Panchakarma Clinic, Secunderabad. Sir has worked as a consultant in private clinic in Ayurveda Aushadhalaya from 2010 to 2011. Sir has worked as a chief consultant in private clinic Prama Ayurveda in Bengaluru from 2011 to 2015. Sir has worked as visiting consultant in Inchera Ayur Kutira since 2016. Sir has post-graduation research work. Sir has done his post-graduation research work from SDM CA Udupi and postdoctoral research work from RGHS. Sir has a teaching experience in Sir is currently working in Sri Sri Ayurveda College as a professor and HOD, and Sir is a UG examiner to different colleges under RGHS Bangalore. Sir is a UG examiner to Amrita University, Kerala. Sir is examiner to Mandsaur University, Madhya Pradesh, and examiner to Pondicherry University, Pondicherry. Sir has done two paper presentation on concept of rasotpatti and rasa Mahavahana and genetic predisposition of male infertility. Sir has so far submitted 7 research articles and has participated in various scientific synopsia. Almost Sir has participated in 13 various scientific synopsia. And Sir has worked as a resource person in 4 different events. And Sir has been an editorial member for RGHS General Peer Reviewer and member of peer reviewer committee of Swastha Health Treatise Journal. Sir has also obtained a diploma in computer software from Aptech Computer Education. Sir has obtained computer basic course certificate from SDMCA. Sir has done certificate course on shortcuts and educational methodology. Sir has a certificate in cognitive behavior therapy. Sir has certificate in humanistic psychology and existential psychotherapy. So, sir is we are actually glad to have you today, sir. Such a teacher who has vast experience, and almost you are literally everywhere, sir. As I was going through your CV, you are literally everywhere in every field of higher system and also out of higher system in various courses. It's really, we are glad to have you today on our session, sir. Welcome you to the session, sir. I welcome you on behalf of whole Jignasa to the session, and I request you to carry forward with the session, sir.
Thank you. Thank you, Mr. Karthik. Thank you for having me. So it's a great pleasure by looking, some student community coming up with a great idea of, spreading the knowledge of Shareera, because I am basically from Shareera department, Shareera person. So they are trying a lot to spread the knowledge of Shareera to the students. So it's a great work. I congratulate the team of Jignasa for their endeavor, and I expect the same from the team in future also. And yeah, so today, actually, I have a little bit of sore throat, so forgive me for my voice. A little bit of Sarvaikrata is there. So, anyways, so we'll start with the two topics. So today, I will be talking about the two topics. One is the pericardium and the heart, and the other one is Indriya Shareera. So these are the two topics given to me, and I shall speak on those two things. And I actually want to talk from the clinical perspective. So even though my slides tries to cover a lot of things, but there are certain things which I want to skip, which I want to avoid, so that to create more, should not create more of confusions. But anyways, we'll try to cover as much as possible. So okay, so let's start with the pericardium and heart. Okay, so yeah, so in recent years, if you see this slide, you can see these are the some of the most eminent people who died recently. And one of the common factor is the cardiac arrest. All of them were like in their early 40s or early 50s. So one of the common cause was the cardiac arrest, and especially the bottom right, Dr. Gaurav Gandhi. He was a cardiac surgeon who recently died, and his death created a lot of news in the media. He was a cardiac surgeon who performed more than 16,000 cardiac surgeries, and finally, ultimately, he died. He succumbed to the same problem, cardiac arrest. Even though he was having his reports, everything was normal. Till now, in the medical fraternity, it has become a mystery, a kind of mystery, why he died because of cardiac arrest. So, anyways, so whenever we see a death certificate, one of the first thing that they mention, the immediate cause of death, is cardiopulmonary arrest. Of course, nowadays the definition of the death is like complete cessation of the nervous system, but still, first there has to be cessation of the heart and the lungs, cardiopulmonary arrest. Usually, in most of the death certificate, they mention the same thing, cardiopulmonary arrest, and then remote cause they would have mentioned some of the other diseases the person might have suffered from. So what happened is, after these incidents in my clinic, most of the patients came with a concern about their heart. Doctor, whether my heart is fine. I work out in the gym, and Dr. Puneet Rajkumar, he died when he was working out. Raju Shivasava, he died when he was working out. So whether I have some problem with the heart, so can you diagnose and can you tell me? So thing is that even nowadays, the patients are more concerned about the health, about the heart. Uh, so being doctors is our responsibility to identify the disease at the early and then give the solution to the patients. So since we are all going to become doctors, so you have to be thorough with the anatomy. So it's a basic knowledge, foundational knowledge. So everyone should be thorough with the anatomy. So moving further, so the things which we are going to discuss in today's class. So actually, according to NCISM, they have described these are the points which they have mentioned. Pericardium with the applied aspect, the histology of the heart, description of the heart, and the structure of artery and vein, and the important blood vessels with their cores and branches. So I just want to omit this last one because so when you talk about the important blood vessels with their cores and branches, so there's going to be a huge topic because we have got so much of blood vessels, important blood vessels. It could be aorta, it could be the larger blood vessels and all those things. So connecting them, talking about them is going to be a little difficult task. So better I am not going to discuss about individual arteries there, but we'll discuss about the other main concepts of the this cardiovascular system. So moving further, so we'll begin with study about the pericardium with its applied aspects. So we'll start with the study of the pericardium. So pericardium, so pericardium is a fibroserous sac. So it is mainly made up of two layers, fibrous and serous. So what you see in this picture here is this is the fibrous pericardium, the first one. What you see here, this fibrous pericardium, and when you open the fibrous pericardium, next what you're going to see is the serous pericardium. So hopefully you can see here this. Sorry, this picture. What you see here, this is the fibrous pericardium within which you have got the heart. So on the next picture, side picture, you can see that the fibrous pericardium is removed and the heart is exposed. So that actually shows the serous epicardium, which is covered by the serous epicardium, which we'll discuss further in the next slides. So yeah, so fibrous pericardium. So this pericardium is a sac which consists of the heart and the root of great vessels. So when I say great vessels, I'm talking about the large vessels here. The like the arteries, aorta, and the pulmonary trunk, and the veins like the pulmonary veins and the vena cava. So these are all along with the heart. They are capsulated, covered by the pericardium. So what is the location? It is located behind the sternum. So in this picture, you can see it is located behind this. This is the heart along with the pericardium. So this is sternum. So it's located behind the sternum and the adjoining the costal cartilages. So mainly the second to sixth costal cartilage, and it lies opposite to the level of T5 to T8 thoracic vertebrae. T5 to 8 vertebrae. So in the supine position, when the person is recumbent, when the person is sitting or standing, it goes one vertebra below, like T6 to T9. Something which you have to remember. Probably it could be asked in the Vivos examination. So yeah, so it consists of, so this pericardium, it consists of a potential space known as pericardial cavity. So some of the important functions which we'll discuss further in the next slide. Yeah, so we'll discuss about the pericardium one by one, beginning from the fibrous pericardium. So if you see the fibrous pericardium, it's a conical sac. What you see here, this fibrous pericardium, it is a conical sac. The apex is blunt. So here we don't get confused between the apex of the heart and apex of the pericardium. So apex of the pericardium is over here. So when you talk about the apex of the heart, usually we talk about this particular part, right? So this is the apex of the pericardium. So it's a conical sac and the apex is present over here. Okay, apex is blunt and it lies opposite to the sternal angle, something which you have to remember again, because when we talk about the in the Vivos examination, we usually talk about the sternal angle because you have got some anatomical terminologies in the YOC. So it could be asked, sternal angle, what are the important things that is happening at this level? So one you can remember, the apex of the pericardium lies at this level, sternal angle, and the base over here, it is blended with the diaphragm. Okay, you can see that it is going to merge with the diaphragm, and when it merges, it forms something called as phrenico-pericardial ligament, phrenico, diaphragm, pericardium, fibrous pericardium. So they attach, they merge with each other. So anteriorly, it is attached to the sternum through sternopericardial ligament, another fibrous tissue, and posteriorly, it is related with the descending aorta and the trachea mainly at the higher level. And laterally, on either side, it is related with the, as you can see in this picture, it is related with the lungs as well as the phrenic nerve and the pericardiophrenik veins. So these are some of the things which you have to remember. When you talk about the serous pericardium, so within the fibrous pericardium, next you will find the serous pericardium. So serous pericardium, it is a double layered. So you have to be very, very clear about it. So when you talk about the pericardium of the heart, we have got fibrous pericardium and serous pericardium. And in the serous pericardium, we have two layers. It's a double layered. So we have got parietal pericardium and visceral pericardium. So when you go to the embryological point, so parietal pericardium is derived from the somatopleuric mesoderm and the visceral pericardium from the splanchnopluric. Probably you might be aware of that. And the visceral pericardium is also known as epicardium. So when you talk about the layers of the heart, usually we talk about the three layers, right? So that is the epicardium, myocardium, endocardium. So the epicardium is nothing but the visceral pericardium. Okay, so should not be any doubt there. So epicardium is very closely adhered with the heart, except the grooves of the heart. Okay, except in these areas, the epicardium completely covers the heart. Okay, so and this pericardium, it is continuous with each other at the root of the great vessels. So you have to always understand that it is a when we talk about the embryological origin, you can see that the pericardium was a sac, and the heart, but it actually invaginates within this sac. So at the level of these roots, this pericardium is reflected. Okay, only at the level of the roots. Otherwise, these are completely surrounding the heart and made up of two layers. And it has got the cavity present between the parietal pericardium and the visceral pericardium is called as pericardial cavity, which encloses about 50 ml of pericardial fluid. Okay, so there's about the pericardium and the contents of the pericardium. It mainly consists of heart, obviously heart, the cardiac vessels and nerves, pulmonary trunk, aorta, that is the root of great vessels like supra vena cava, infra vena cava, and pulmonary veins. Okay, so in this picture, you can see the heart here, you can see the aorta, right? Okay, so in this picture, you can see the pericardium here. Okay, so in this picture, you can see the pericardium, right? So mainly this is the epicardium, which is reflected. Okay, so next coming to the sinus of the pericardium. So the pericardium, it mainly consists of two sinuses. So sinuses means the spaces. So as I told you earlier, this pericardium is completely covering the heart and it is reflected at the root of the great vessels. So what happens is it shows two spaces, the way we call them as the sinuses. So we will find two such sinuses. One is the oblique sinus and the other one is the transverse sinus. Okay, so oblique sinus, it is present behind the heart, which you can see in the next picture. So oblique sinus, it is present behind the heart. Anteriorly, it is related with the left atrium of the heart, and on either side, it is related with the reflections of the pericardium. Okay, and pericardium around the pulmonary veins. And posteriorly, it is related with the parietal pericardium. I will show you the picture, you get an idea. And then you have got another sinus, that is transverse sinus. So again, as the name itself says, it is transverse. So it is present in front. Anteriorly, it is related with the aorta and the pulmonary trunk, and posteriorly, it is related with the superior vena cava and the left atrium. So if you see in the next picture, am I there? Mr. Karthik?
Yes, sir. Yes, sir. You are audible.
Yeah. Okay. Whether the screen is visible?
The screen sharing stopped, sir.
Just a minute. Some glitch is there. Just a minute.
Yes, sir. The screen is back online.
Is it visible now?
Yes, sir.
Online? Okay, fine. Okay. So we were discussing about pericardium. Yeah. So I was talking about the sinuses. Okay. So here, if you see, we have these two sinuses. One, this is the oblique sinus. You see here. So this sinus, actually, if you see, it is present. So if let us say, assume that we are keeping a heart there. Okay. So when you keep the heart, it will be present behind the heart. So we obviously it will be coming in relationship with the left atrium. And you can see that on either side, it is bound by the pulmonary veins. Okay. The reflections around the pulmonary veins. Okay, so this sinus is the oblique sinus, and this sinus, what you see here, this is the transverse sinus. Okay, you can see that it is present behind the pulmonary trunk and the aorta, and in front of the superior vena cava and this pulmonary veins. So when you see in this picture, you get an idea. So you can see that the hand is passing beneath the heart, that is into the oblique sinus. And here you can see the finger is in the transverse sinus. Okay, so these are the two sinuses of the pericardium. So which you should remember. So these are the two sinuses, the oblique sinus, which is present behind the heart, okay, and the transverse sinus, which is present between the arterial and the venous. So when I say arterial, I'm talking about the pulmonary veins and the aorta and the superior vena cava behind. Okay. So next, talking about the blood supply of the pericardium. Okay, so usually the artery supply is mainly by the interthoracic artery, pericardiphrenic artery, the branches of the aorta, and the branches of bronchial and esophageal arteries. Venous drainage is by the azygous vein, hemazygous vein, interthoracic vein, and inferior phrenic vein. Nerve supply. So nerve supply is very important. The fibrous and parietal pericardium is supplied by the phrenic nerve, right? And the visceral pericardium is supplied by the vagus nerve. Clinically, very important. Next, functions of the heart, pericardium, sorry. So main functions are protection of the heart. So obviously, since the fibrous pericardium, especially a thick fibrous structure covering the heart, so it helps as a mechanical support. It protects the heart. Second, the serous pericardium, which consists of the pericardial fluid, it helps to minimize the friction whenever the heart is moving, pumping. It helps to minimize the friction. Plus, it also prevents the excessive fall of diastolic pressure. So whenever the ventricle is filling, okay, so it helps to prevent the excessive enlargement of the ventricles, because it forms a solid protective layer, boundary, a limit to the heart. Prevents infection also, and also provides signal for embryonic heart formation and maturation. Like, talking about the systemic embryology, you know that this the formation of the pericardial area, cardiogenic area, just above the procaudal plate, it decides the place that yes, this is the location where the heart is going to be developed. So this pericardial cavity during the ecological period, it also plays an important role, that yes, this is the place where the future heart is going to be developed. Some of the applied aspect, one is constrictive pericarditis. Sometimes maybe because of the infections like tubercular infection, this pericardium may get inflamed. We call that condition as pericarditis. And sometimes there may be, because of the infection, because of the pericarditis, so the pericardial capillaries, they may start producing some fluid which may fill the pericardial space. We call it as pericardial effusion. And pericardial effusion, if the effusion is more, if it is filled with large amount of fluid, then it can start putting pressure over the heart and may prevent the heart from functioning, from dilating. So that condition is called as cardiac tamponade, something which is fatal. And the removal of the fluid, which is called as pericardiocentesis, this is the main treatment procedure. Okay, next we'll move to the topic of heart. Okay, so heart. So we'll talk about the heart. So this is something which I advise all the students. So whenever you study about any anatomical structure, for the anatomy, be thorough with the external features first. Okay, external features are very, very important. Why? Because whenever we talk about the heart, okay, or any other anatomical entity, so what we in anatomy, what we study is the structure, the shape, the dimension, the measurement, everything, the weight, everything. So we have to concentrate on the external appearance, external features of the heart. What is the location? What is the relation? So those are the things which matter most in anatomy examination. Uh, though I'm not blaming the students, but the thing is that the students are more lean towards the physiology. So whenever uh, a structure is asked in the examination, usually students end up writing the physiology. Okay, but this should not happen here. Okay, so in anatomy, being a evaluator, eye care understand that all the evaluators, they will be looking for the anatomical entities, the structure of the organ. So be thorough with the external features first. Okay, it could be any organ, but be thorough with the external features. So yes, when you talk about the heart, usually heart mainly consists of two kind of circulation, that is pulmonary circulation and systemic circulation. Yes, so let's come jump to the structure of the heart. So what is the location? So location, it is present in the middle mediastinum. So you know what is mediastinum is? It is the space present between the two lungs. So it is present between the two lungs, behind the sternum and the adjoining costal cartilages. It is present within the pericardium. Okay, and shape, the shape of the heart, it is conical in shape. Measurement, it measures about 9 centimeters near the base. So you have to understand that apex is present here and the base is present posterior, it is present located behind. Okay, so we'll discuss about that later. So 9 centimeters near the base and 12 centimeters from base to apex. Okay, so from base to apex it will be 12 centimeters, and the anteroposterior measurement is about 6 centimeters. Okay. Um, Weight, it weighs about 300 grams in males and 250 grams in females. Okay, so this is the picture showing the location of the heart. You can see the heart is located over here behind the sternum and in front of the vertebrae. So if you remember, I told you from T5 to T8 in supine position, and it goes one vertebral level below when in the recumbent position, T6 to T9. Okay, so here you can see the actual heart over here, heart. Okay, sternum is removed, and this is a radiological picture of the chest. So you can see the location of the heart here. Okay, next, surface marking of the heart. So this again very important. It may or may not be asked in the examination, in the theory examination, but practical, if you see in the practical examination, one of the question is from the surface marking. So they may ask a question from the surface marking, marma. So surface marking, when you say surface marking, it could be asked. Surface marking of the heart, surface marking of the lungs or pleura or liver. So usually surface marking of the heart is very frequently asked, or the most important. So be thorough with the surface marking of the heart. So you can see the surface marking of the heart. So we have to draw 4 points here, and we have to connect those points. Okay, so first surface marking of the, we have to mark first the two borders here, one upper border and the lower border. Okay, for that first you have to mark up 4 points over here. Okay, so first point would be about in the second costal cartilage, lower border of the second costal cartilage, about 1.3 centimeters from the lateral margin of the sternum. Second point on the upper border of the third right third costal cartilage, about 0.8 centimeter, that is 8 millimeters from the right sternal border. And then you have to mark two lower points, one here in the sixth costal cartilage, about 2 centimeters from the right sternal margin, and the other one in the fifth intercostal space, about 9 centimeters, from the mid sternal point. So you have to mark these 4 points, and then you have to connect. So first you connect these 2 points and you get the upper border, and then you connect these 2 points and you'll get the lower border. Next, we have to draw the other two borders, which will give you the surface marking of the right and left borders. So for the right border, you have to connect the two right ends, two right points. Okay. And one thing is that here, when you connect, the maximum convexity of this line will be in the fourth intercostal space, about 3.8 centimeters, from the right sternal margin. So this will be the right border, and the left border is drawn just by connecting the two left points. Okay, so this will give you the surface marking of the heart. Next, again, it could be asked in the examination, a clinical point. So oscillatory areas. So these are the 4 points where you usually auscultate for the heart sounds. So that is the one is the aortic valve area, the pulmonic valve area, tricuspid valve area, and the mitral valve area. So these are the 4 points which you have to uh, mark for the auscultation. So it could be asked in the VOC especially. So just go through this. Okay. Next, histology of the heart. So this time, the NCSM syllabus, they have made histology as a mandatory topic. So histology is there for every organ. So when you talk about the histology of the heart, so as like any other part of the circulatory system, like it could be arteries or veins, even the heart, it also has three layers. That is epicardium, myocardium, and endocardium. So other names for the epicardium is tunica adventitia, myocardium tunica media, and endocardium tunica intima. Okay. So here in this picture, you can see the outermost layer, the tunica adventitia or the epicardium, and the thick layer over here, this is the tunica media or the myocardium, and the last endocardium. Okay. So we'll discuss one by one. First one, epicardium, tunica adventitia. So this layer, so as if you remember, we discussed while discussing about the pericardium. So the vessel pericardium is nothing but the epicardium. Okay. So this is made up of a simple squamous epithelium, nothing but epithelium. So this is the one which actually helps to secrete the serous fluid. Okay. And the fibroelastic tissue. Okay. So outermost layer would be the mesothelial layer, and then you have got a fibroelastic tissue. You'll find some of the blood vessels, lymphatics, and adipose tissue. These are the main contents of the outermost layer. Next, you have got the myocardium, tunica media. So tunica media, it, it is also called as the myocardium. It is the largest among all the three layers, and it mainly consists of the muscles, okay, muscle tissues, fibers, and loose endomysic connective tissue, and contain lots of capillaries. Okay, so this brings us to study about the musculature of the heart. Okay, so when we talk about the musculature of the heart, so first let us discuss about the fibrous skeleton of the heart, something which forms a framework for the heart, so that the muscles which origin and are inserted to this particular structure, the fibrous skeleton of the heart. So this fibrous skeleton is a rigid framework of dense, regular fibrous connective tissue. These are actually the four fibrous rings which are present around the atrioventricular and the arterial orifices, which you'll see in the next slide. And then these rings are interconnected by two thick fibrous structures, that is trigonum fibrosum dextrum. Dextrum means the one which is on the right side, trigonum, a triangular structure. So trigonum fibrosum dextrum, and the other one is trigonum fibrosum sinistrum. Sinistrum means towards the left side. Okay, so you'll find these two structures. Okay, so here in this picture, you can see the atrioventricular rings over here, right? So this is a bicuspid and the tricuspid. That is left atrioventricular, right atrioventricular, and then you can see the arterial rings. These are aortic and this is pulmonary. So around these rings, you'll find a thick fibrous structure. Okay, we call them as the arterial rings, and these rings, they are connected by this triangular structure over here, right? So these are the skeletons, trigonum fibrosum dextrum, this one, and this is the trigonum fibrosum sinistrum. These are the two things which are going to connect these arterial rings. Okay, so their main function is to support the chambers. They form a rigid framework for the heart muscles. They are attached, so the muscle fibers, they are attached to this in the figure of number 8. And the main function is it forms an insulation between the atria and the ventricles, so that there is a slight delay whenever the conduction of the heart is taking place. So this plays an important role, so that the conduction, there will be a slight delay of depolarization between the atrium and ventricle, so that both the chambers should not contract at the same time. First the atrium contracts, the filling of the ventricles, and then the ventricle contracts. Okay, so for the delay, this fibrous skeleton of the heart plays a very important role. Okay, so this is how the the fibers, muscle fibers are attached. Okay, so this is another picture of the same. You can see the muscle fibers which are attached. So here, if you see, actually there is a slight change in the muscles of the atrium and ventricle. So usually in the atrium, you'll find the two types of muscles. Excuse me. The superficial transverse and the deep annular and the loop muscle fibers. And in the ventricular musculature, you will usually find the spiral kind of muscles, so which are usually attached from this fibrous skeleton to the papillary muscles. So here, so in this slide, I have tried to discuss more in detail about the muscles of the cardiac muscles. We know that there are mainly three types of muscles: striated, non-striated, and cardiac muscles. So cardiac muscles, in most of the time, it looks like the striated muscles or somatic muscles, but there is only the difference is these are involuntary in function, and these muscles, there are certain differences are there, which you can see in the later slide. So in this slide, I have tried to compile the difference between a skeletal muscle, a cardiac muscle, and a smooth muscle. So you can take a snapshot about the same, and you can study about them later. Okay, so these are some of the differences and the similarities between the skeletal, cardiac, and smooth muscle. So usually it could be asked in the Vivos examination. What are the similarities or difference of the cardiac muscle? Why they are different? Okay, again, this slide also tells you about the difference between the skeletal, cardiac, and smooth muscles. So you can take a screenshot of about the same, and then you can just go through the information. Okay, and then finally the last layer of the heart, there is a tunica intima or endocardium. So endocardium, it lines the atria and ventricles. It cover, again, you have to understand that it also covers the heart walls, very important, and it is lined by the endothelium and underlying basement membrane. It also consists of loose connective tissue as well as the adipose tissue. Okay, so with this we come to the end of the layers of the heart, the histology of the heart. Okay, next coming to the features of the heart. Okay, so we talk about the features of the heart again, like we discussed earlier: epicardium, myocardium, and endocardium, and then we are going to talk about the external features. Okay, so very very important, you have to go through this and you have to memorize these things, because in the examination, if it is asked, first you have to highlight about the external features. Okay, so the heart mainly consists of four chambers, two atria, two ventricles, and auricles. So auricles, they are the appendage of each atrium. So do not make a mistake of naming the chambers like two auricles and two ventricles. No, because in some of the books, like when you are in plus two PUC, you might have said that the heart has four chambers, auricles and ventricles. So in here, you have to understand that auricles are the ear-shaped appendages which are present to the atrium. They are not synonyms. Auricles are separate, atrium are separate. So do not make this mistake of writing auricles in the examination. Write that it has got four chambers. There are two atria and two ventricle. Auricles are the appendage of each atrium, ear-shaped appendage. I mean, the pinna-shaped appendage. Okay, it has got four grooves, atrioventricular grooves, and which is also called as coronary sulcus. The anterior interventricular groove, which separates the two ventricles anteriorly, interatrial grooves, which separates the right atrium from the left atrium, and the posterior interventricular groove, again, which is going to supply the two ventricles, right and left ventricles, but which is located inferiorly, which we can see in the next picture. So here you can see the heart. Okay, you can see this sulcus over here. This is the coronary sulcus or the atrioventricular groove, and here you'll find another groove over here. This is the groove which is present between the right ventricle and the left ventricle. So this is the anterior interventricular groove. So here you can see the same in little detail. This is the coronary sulcus or atrioventricular groove. This is the right atrium. This is the right ventricle, right? So this groove is separating the right atrium from the right ventricle. This is the atrioventricular groove. So this groove, it extends posteriorly also. That's why it's called as coronary. Corona means like the crown. So it's also called as coronary sulcus. And here you can see another groove over here. This is the anterior interventricular groove. Okay. This is the posterior view of the heart. So here you can see this is the right atrium and this is the left atrium. So in between them, you'll find a groove, this shallow groove over here. This is the interatrial groove. And in this picture, you can see this groove over here, right? So this is the posterior interventricular groove. Okay, so you can see the left ventricle, right ventricle. So this is the posterior interventricular groove. Next, coming to the parts of the heart. So parts, the main parts of the hearts are, it has got an apex, a base, border. Okay, so when you talk about the anatomy, we have to talk about the borders and surfaces. Okay, might sound boring, but very, very important. Okay, so parts of the heart, it has got a apex, base, borders. Borders, it has got four borders: the right, left, superior and inferior border. And then it has got three surfaces, that is anterior surface, inferior surface, also called as diaphragmatic surface, and the left surface. Okay, so apex is formed mainly formed by the left ventricle. So what you see here, this is the apex, which is mainly formed by the left ventricle. So it is directed downwards and forwards. So you can easily feel the apex beat at the fifth intercostal space. You don't need to, even by just keeping your hand firmly just below the nipple in the fifth intercostal space, you can feel the apex beat. Okay, it is overlapped by the anterior border of the left lung. One of the important relation you have to remember. Next, base. It can be also called as the posterior surface. So if you see in the surfaces, we have mainly discussed anterior surface, inferior surface, and left surface. So the base is mainly formed by the posterior surface, mainly by the left and right atrium. So so we can replace posterior surface with the base of the heart, or you can say that base is also formed by the, also called as the posterior surface. Okay, so it gives opening for the pulmonary veins and for the superior and inferior vena cava. So base is the one which lies opposite to the level of T5 to T8 vertebrae. So here you can see the apex. Okay, you can see the borders. If you decide the borders, you'll be having the superior border, right border, inferior border, and left border. You have got an apex, and this is the base over here. So we are looking from this is posterior view. What you see here, this is the base of the heart, or also the posterior surface, which is mainly formed by the left atrium over here and the right atrium. You can see the opening of the left and right pulmonary veins, as well as the superior and inferior vena cava. Next, borders. So as I told earlier, it has got four borders. Upper border, which is mainly formed by the left atrium and right atrium. Right border, which is mainly formed by the right atrium. Left border, mainly formed by the left ventricle and a small part of the left auricle. And inferior border is mainly formed by the right ventricle and a small portion of the left ventricle. Okay, surfaces, three surfaces. Anterior surface, mainly formed by the right atrium and right ventricle, a small portion of the left ventricle. Inferior surface, this is the one which actually sits on the center tendon of the diaphragm, and it is mainly formed by the left and right ventricles. Okay, and the left surface is mainly formed by the left ventricle and a small portion of the left auricle. Okay, so if you see in this picture, the superior border, right border, inferior border, left border. Okay, and the surfaces, what you see here, this is the anterior surface. Inferior surface is resting on the center tendon of the diaphragm, and here is the left surface. And the posterior surface is present behind, which is also called as the base. So there should not be any confusion. Next, coming to the chambers of the heart. So chambers of the heart, So we have got this right atrium. So right atrium. So these are some of the features we have to remember. So when we talk about the chambers, usually students end up writing the physiology. So I want you to follow this, mainly write about the structural entities here. For example, in the right atrium, just observe what are the features you are going to see. One, the sulcus terminalis, a ridge, crista terminalis, the location of the SA node. Okay, and in the internal features, you'll mainly find a smooth posterior part called a sinus venerum, because it is going to drain the blood from the vena cava. You've got a rough anterior part called as the pectinate part, and you have got in the intraatrial septum, you'll find a small depression called as fossa ovalis, and it also has opening for the coronary sinus. So not only this, not only the venous drainage from all over the body, even the venous drainage from the heart, it is drained into the right atrium. So if you see this picture, so this picture shows you the features of the right atrium. So here you can see the window dissection of the right atrium. You can see this is the crista terminalis. So here on this picture you can see this is sulcus terminalis. So if you cut and open, you will see a ridge over here. So this ridge what you see here, it is a crista terminalis, and you can see some of the muscle fibers over here, which looks like the comb. So these are called as musculae pectinati. And this portion what you see here, this is the posterior part. It is a sinus venerum, a relatively smooth feature. It doesn't have any such muscular ridges. So this is the sinus venerum, which gives opening for the inferior vena cava as well as the superior vena cava, and also you can see the coronary sinus, which will be opening into this. And here in this you'll find this portion what you see here is the intraatrial septum. Over here you can see a small depression. It is the fossa ovalis, which is a remnant of foramen ovalis. Okay, so this is about the right atrium. So try to mention these features. Okay, and we'll talk about again the same here, right atrium. So next is the right ventricle. So when we talk about the right ventricle, we know the physiological aspect, that it is going to receive the blood from the right atrium. So apart from this, when we concentrate on the anatomical part, so here you'll find it mainly consists of two parts: a rough inflowing part and a smooth outflowing part. So the rough inflowing part is called as trabeculae carneae, and the smooth outflowing part is called as the infundibulum. Okay, so it has got two orifices. There is one right atrioventricular orifice through which the blood enters into the chamber, and the pulmonary orifice through which the blood exit from the right ventricle through the pulmonary trunk. Okay, so the inflowing part, it mainly consists of the muscles, ridges, bridges, pillars, and here you have to mainly concentrate about these pillars here. Okay, so you usually have these three types of pillars here: anterior, posterior, and the septal. Okay, so septal is the one which is coming out from the interventricular septum. Okay, and then it has this chordae tendineae. Okay, chord tendineae, these are mainly made up of collagen fibers, which actually helps or support these atrioventricular walls from closing. Okay, when after the atrial systole. Okay, so when so it helps, this coordinate helps the back of the blood as well as the valves. Okay, and then one of the most important thing which you have to remember here is the moderator band. Okay, so it's a muscular ridge which is connecting the anteropapillary muscle to the interventricular septum. What does it contain is the right branch of atrioventricular bundle. Maybe another question for the IOC. Okay, and comparatively, compared to the size of the left ventricle, it is much thinner, 1/3 thinner than the left ventricle. Okay, so here in this picture you can see the structure of the right ventricle. You can see the papillary muscles over here. Okay, so this is the rough inflowing part, and this portion what you see here, it is a smooth outflowing part. So rough inflowing part, this is the trabeculae carneae, okay, which consists of muscles, and this smooth outflowing part here, this is the pulmonary infundibulum. Okay, so this is a comparison between the right atrium the right atrium over here, sorry, right ventricle and the left ventricle over here. Just compare the thickness of the size here. The left ventricle wall is 3 times larger than the wall of the right ventricle. Next, coming to the left atrium, so relatively a simple chamber. It's a quadrangular chamber. It occupies the left 2/3 of the base of the heart. Okay, so it receives the oxygenated blood from the lungs and pumps it to the left ventricle through bicuspid orifice or mitral wall. Okay, features, it mainly consists of, again, muscular pectinity is smooth walled, relatively smooth walled. It consists of muscular pectinity similar to that of what you saw in the right atrium, but mainly it is found in the left auricle. Otherwise, in the anterior wall, it's very minimum. So it has got a small depression called as fossa lunata, which corresponds with the fossa ovalis in the right atrium. Okay. So here, this is the right atrium, and this is a section of the right atrium. You can see the section of the right atrium over here. So relatively smooth walled chamber. You can see the fossa lunata, which corresponds with the fossa ovalis on the right atrium. And here you can see the left auricle, and here you'll find these small muscle fibers, muscular pectinity. Okay. Next is the left ventricle. So left ventricle, functionally, of course, it receives the oxygenated blood from the left atrium. It also has two parts, the lower rough part and the upper smooth part. So lower rough part, again, it's also called as trabecular carneae, and the the upper smooth part is called as iotic vestibule. Okay, so it has two orifices, bicuspid or mitral orifice and the iotic orifice. So it consists of papillary muscles similar to that of the right ventricle. The only difference is that in the right ventricle you have three papillary muscles, anterior, posterior, and septal. Whereas in the left ventricle you have got only two papillary muscles, that is anterior and posterior, which of course connect to the carotid tendinae, again, which will be connected to the atrioventricular walls. So the walls of this left ventricle are 3 times larger than or thicker than the right ventricle. So here is the picture of the left ventricle. You can see the chamber over here. This is a smooth inflowing part. Okay. And posterior to that, you will be having the outflowing part. So in this picture, you can see the chamber over here. This is the aortic vestibule through which the blood will be flowing upwards. Okay. Next is the valves of the heart. Okay. So valves of the heart. So it mainly consists of the 4 valves, that is 2 atrioventricular or AV valves and 2 semilunar valves. So 2 atrioventricular valves, these are the one which are controlling the blood flow from the atrium to ventricles. So one on the between the right atrium and right ventricle, and one on the left side between the left atrium and left ventricles. Okay. Right atrioventricular valve, also known as the tricuspid, and the left atrioventricular valves, also known as bicuspid. It has got 2 semilunar valves which are regulating the blood flow to the pulmonary trunk and to the aorta. So they are called as aortic semilunar valve and pulmonary semilunar valves. Okay, so in this picture you can see here you can see the atrioventricular valves over here. Okay, so you can see the 3 cusps over here. So this is the tricuspid, and here you can see the 2 valves over here. These are the bicuspid. Here it is open, and in this picture you can see these are closed. Similarly, here you can see the semilunar valves. So you can see this is the pulmonary, and these are the aortic. So you can see that is open over here and it is closed over here, right? So next is aortic sinuses. So these are the 3 dilatations present at the beginning of the aorta. So you can see in this picture. So there are small spaces over here. These are the aortic sinuses. Okay. So these sinuses, it gives out origin to 2 small arteries, the right coronary artery and left coronary artery, the major source of blood supply to the heart. Okay. So right coronary artery, it originates from the anterior aortic sinus, and the left coronary artery from the posterior aortic sinus. Okay. So very important. So in short, you can say that the right and left coronary arteries are the first branch of the aorta. So some of the applied aspects, so valvular stenosis, that is narrowing of the valves, and valvular insufficiency, the artery supply of the heart. So it is mainly supplied by the right and left coronary arteries. So right coronary artery, it gives out two branches, that is right marginal and posterior interventricular artery. So left coronary artery, it gives out two branches, that is anterior interventricular artery, also called as left anterior descending artery, a very important branch. Okay, and the circumflex arteries. So these are the main two arteries which will be supplying the heart. And talking about the venous drainage, it is mainly drained by three veins: great cardiac vein, middle cardiac vein, small cardiac vein, and also oblique vein of Marshall. Okay, so all of these veins, they will be drained mainly to a larger sinus called as coronary sinus, which finally opens into the right atrium. Okay, apart from this, it also drains drain from the small veins called as vena cava minimi. Okay, so in this picture, so this is a superior view of the you can see the aorta here. You can see the two branches coming, two arteries coming from the atrium, sorry, aorta. So this is the right coronary artery, and here it is the left coronary artery. So two coronary arteries supplying the heart. The further, this is another picture of the same. So here you can see the right coronary artery coming from here, and it is the left coronary artery. So right coronary artery, so this is another view of the same. You can see the right coronary artery over here, left coronary artery. So right coronary artery gives out two branches. One is the right marginal artery here, and the other one, so you can see in this picture, the right coronary artery is continuing posteriorly. It gives out another branch over here. This is the posterior interventricular branch. Okay, and the left coronary artery, it gives out two branches. One, this is the anterior interventricular branch, also known as the left anterior descending artery, and the other one is the circumflex artery. So these are the main branches of the coronary artery. And here you can see the venous drainage. You can see the cardiac veins over here, small, middle, and great cardiac veins, which will be joined to the coronary sinus, which ultimately opens into the right atrium. So talking about the lymphatic drainage, so it drains lymph from deep and superficial sets. So you can just go through that later. And talking about the nerve supply, very, very important. So it is mainly supplied by sympathetic and parasympathetic. So thankfully we don't have the somatic nerve supply to this. So it is mainly having sympathetic and parasympathetic. Okay, sympathetic is mainly from T1 to T5 segments, and parasympathetic from the vagus. So sympathetic, it increases the rate of contraction, and the vagus, parasympathetic, it decreases the rate of contraction. So one thing we have to understand that these nerves, they only have influence over the heart, but they are not the one which can stimulate the heart. Okay, because heart cells, it mainly consists of some autorhythmic cells, which we'll be discussing later. Okay, these are some of the videos. So I don't think it's required now. Okay, so next is we are talking about the conduction of the heart, conductive system of the heart. So again, it's more of a physiology topic, but we have to understand the structures involved in the conduction of the heart. So here, the conduction of the heart, it mainly consists of these entities. It is the sinoatrial node, okay, also known as the pacemaker, from where the impulse will be transferred to the atrioventricular node, and from there through the atrioventricular bundle, also known as the bundle of His, which further divides into right bundle branch and left bundle branch, and this further divides into Purkinje fibers, which will be supplying the entire chambers. Some of the applied aspects some of the applied aspects are: one is the ectopic cordis, that is the heart will be situated outside the thoracic wall because it's a embryological defect. So other one is the patent foramen ovalis. So foramen ovalis fails to close, so that will result in a patent hole in the and a connection between the right atrium and left atrium. Dextrocardia, a condition where the heart will be directed right towards the right side. That means, we know that the apex is usually directed towards the left side. In dextrocardia, the apex will be towards the right side. Okay, sometimes it may be associated with another condition called as situs inversus, where all the structures on the right side, like the liver and all, will be present on the left side, and the structures on the left side will be present on the right side. This condition is called as situs inversus. Dextrocardia may or may not be associated with the situs inversus. Some of the other apparent aspect, that is atrial septal disease or atrial septal defect, deformity in the intra-atrial septum. Similarly, ventricular septal defect, deformity in the ventricles. So in this picture, you can see the atrial septal defect, and here in this picture, you can see the defect between the ventricles. So there is a connection between the left ventricle and the right ventricle. So these are the examples of anomalies. And here there's another condition called as Fallard's tetralogy, which usually involves four pathological conditions. All these four pathological conditions will be present together. That is pulmonary stenosis, first one, where the pulmonary trunk will be stenosed, will be narrow. Okay, so it is the first pulmonary stenosis. Second one, the overriding of aorta. So we know that the aorta will be present only in the left ventricle. Sometimes it may extends into the right ventricle also. This is called as the overending of aorta. Then you have the ventricular septal defect. There is a connection between the left ventricle and right ventricle, a ventricular septal defect. And then right ventricular hypertrophy. So we know that the thickness of the right ventricle is 1/3 of the left ventricle. But in this condition, because of the overriding of the aorta, so there is a more pressure over the right ventricle, resulting in the hypertrophy of the wall. Okay, so when all these conditions are present together, it is called as Fallard's tetralogy. So there's another condition called as patent ductus arteriosus. So we know that in embryology, fetal circulation, there was a connection between the pulmonary trunk and the aorta. So after the birth, it will be remain to a small fibrous structure, but if it remains patent, then this condition is called as patent ductus arteriosus. Okay, and coarctation of aorta, that is stricture of the aorta. So we know the aorta over here. Sometimes it may becomes narrow. Okay, when it becomes narrow, okay, so you can imagine the blood will be flowing with much great pressure over here. So when it becomes narrow, there will be backflow of the blood to this condition. Okay, so this is called as coarctation of aorta. So this is about the applied anatomy of the heart. Okay, so next coming to the cardiovascular structure. So about the blood vessels. So here I just want to take some time regarding the blood vessels. So I won't go in detail about each and individual vessels, but I will talk about the major concepts in the blood vessels. Okay, that is, let us talk about the arteries first and the veins. Okay, so the basic structure of the arteries, similar to that of the heart, it also has got three layers. That is tunica intima, tunica media, and tunica adventitia. Okay, so tunica media. So this is the one which is very, very important in terms of arteries, because arteries, the tunica media is more predominant. Either it is made up of elastic tissue or the smooth muscles. Okay, so the elastic tissue is usually found in large arteries, and the smooth muscles, they are usually found in the peripheral arteries, which we'll discuss in future. Okay, and the tunica adventitia, it is the connective tissue which is mainly made up of collagen fibers, and it is the one which is surrounding the blood vessels. Okay, arteries. So when you talk about the types of arteries, mainly we can classify these arteries into elastic and muscular arteries. So elastic arteries, they are usually found in large arteries like aorta or the carotid arteries, and in the limbs like the subclavian artery, axillary, common iliac artery. So in these large arteries where the blood is flowing with much pressure, So these arteries, they will be they have to expand a little. So these arteries have got good amount of elastic fibers there. And as you go further in the limbs, like radial and ulnar arteries, the femoral and popliteal arteries, so here you'll find that the tunica media will be mainly predominant with the smooth muscles. So such arteries are called as muscular arteries. So just be thorough with this classification. It could be a vivo's examination. Give example for muscular arteries or give example for elastic arteries. Okay, so some of the differences between the elastic and muscular arteries. So you can take a screenshot of this slide and you can study about this later. Again, next, arterioles. So as we discussed, initially the arteries are elastic arteries, the large arteries. As they move further, they become more of muscular arteries, and these muscular arteries further they continue as the arterioles. So these arterioles, they are progressively decrease in its caliber, in the diameter. They gradually go on decreasing. So the muscular arterioles, their diameter is about 100 to 50 micrometers. Okay, and the arterioles which are lesser than the 50 micrometer in diameter are called as terminal arterioles. Okay, so here I have just given the difference between the muscular arteries and the arterioles. So you can just go through that. It could be helpful for you. So here in this picture, you can see the difference between an elastic artery, muscular artery, and the arterial artery. So you can see the gradual difference in these arteries. First, initially the elastic arteries, and then muscular arteries, and then finally the arterioles. Okay. Finally, the capillaries. So the terminal arterioles, they continue into capillary plexus. Okay. So these capillary plexus, they are the one which actually pervades into the tissue. Okay. So because we have is a very, very important capillaries, these are the one which are going to supply the blood into these tissues, because these are the one which are pervades, which actually spreads into the tissues. Okay. So of course their arrangement and its density varies from tissue to tissue. The main function is to exchange between the blood and the tissue. Okay, so that is mainly taking place in the capillary plexus through the post capillary venules. We'll discuss about that in the future slide. So the average diameter of a capillary is 8 micrometers. So you can understand how small, how thin they are. The wall of a capillary is formed essentially by endothelial cells. Okay, so the types of capillaries, we usually find two types of capillaries here. One is continuous capillaries, and the other one is fenestrated capillaries. Okay, so continuous capillaries, as the name itself says, the endothelial cells, they are very tightly adhered with each other. There is no gap between them. Whereas the fenestrated capillaries, as the name itself says, fenestra means window. There is a space. Okay, so between the cells, you'll find small spaces. Okay, so just go through the examples of this, where you will find the continuous capillaries and where you will find the fenestrated capillaries. Very important. It could be a VOC question. Okay, so here you can see the connection between the capillaries over here. Okay, so you can see the small capillaries over here. These are all the capillaries, and here you can see the venules. So there is a connection between the capillaries and the venules. Okay, this is something which I was talking about earlier. So here usually you'll find this. This is the example for the fenestrated capillaries, which you usually find in the glomeruli of kidneys. An example. Next, thoroughfare channels. So what are these thoroughfare fare channels? These are the channels which connect the arterioles and venules apart from the capillaries. Okay, so they have a larger caliber. Okay, so these are made up of isolated smooth muscle fibers and may be present on their walls. So if you see in this picture, you can see this structure. What you see here, it is a thoroughfare channel. Okay, so here you'll find the capillaries. So apart from these capillaries, you'll find this thick structure over here. These are called as the thoroughfare channels. So why it is important? Because a thoroughfare channel and the capillaries associated with it are referred to as microcirculatory unit. Okay, so what you see in this picture is actually a microcirculatory unit. You can see a thoroughfare channel and the associated capillaries. So this forms a microcirculatory unit. Next, one more important thing is about the sinusoids. Okay, so in some tissues, the exchange network is made up of vessels that are somewhat different from capillaries, and they are called as sinusoids. So usually you will find them in the organs like liver. Okay, so the major difference between them are like this. So you can just go through about the difference between the capillaries and sinusoids, which may be important clinically. You can just go through that. You take a screenshot and just go through the differences, major differences. Okay, so this is another picture which actually shows the difference between the capillaries over here. You can see the continuous capillaries, you can see the fenestrated capillaries over here, and you can see the sinusoids, okay, with large gap between the cells. And finally, end arteries. End arteries, very important clinically as well as from the biopsy point. Usually this will be asked in the examination. Probably it may asked in the theory also. Okay, so end arteries. So end arteries, these are the one which do not anastomose with the neighboring arteries. They are called as end arteries. So examples, always remember these examples, very, very important. Central artery of the retina and the arteries of the spleen, kidney, lungs. Mainly, just remember the central artery of the retina. Okay, a very good example of for the end arteries. Okay, next coming to the veins. Okay, so similar to that of the arteries, they also have three layers: the tunica intima, tunica media, and tunica adventitia. Okay, so they can be easily distinguished, especially in the large veins. Okay, so classification, they can be mainly classified into superficial veins, which are located in the superficial fascia, deep veins, which are located in the muscles and bones, and the connecting veins, which connect these superficial veins and deep veins. Very important from the clinical perspective. Okay, so one of the very frequently asked question, even this point is there in your NCSM syllabus, the difference between arteries and veins. Okay, so just go through these differences. Okay, very important. You can take the screenshot, memorize them. It will be very, very important. It could be asked the examination. Just go through this. Okay, again, major difference between the artery over here and this is a picture of the veins. Okay, you can see the artery and vein over here, artery and vein. You can see the difference between them. Okay, see another picture over here. Okay, the other important aspect of veins is that the veins have something called as valves. Okay, so these help for the to prevent the regurgitation of the blood, because you know that the bloods are moving, against the gravity, especially in the lower limbs. Okay, so to prevent the backflow of the blood, okay, they are supported by the walls. So these walls are mainly made up of a fold of endothelium, the innermost layer of the walls, tunica intima. So the folds of that endothelial layer, they are the one which forms the walls. Okay, so in this picture you can see the walls over here. So it's a section of the vein, and here you can see these are the walls of the vein. Okay, so this is how the veins are located. So usually the blood moves in upward direction, right? So these walls actually helps to prevent the backflow of the blood. Okay, they help to facilitate the unidirectional flow of the blood in the veins. Okay, then after the veins you have got the branching of the veins. They are the venules. These are the venules are the smallest vein. So these they are the one which drain into the capillaries. So these are the which we discussed earlier: microcirculatory circulatory unit, capillaries, thoroughfare channels, and the venules. Okay, so these are the one which actually form the microcirculatory unit. So here the diameter of the venules are about 20 to 30 micrometer. Okay, so they also have similar to features of the arteries. So coming to the blood supply and nerve supply of the blood vessels. Okay, so the small blood vessels, they receive the nutrition through diffusion. The walls of the large and medium-sized blood vessels, they have their own blood supply, and those blood vessels, those small blood vessels are called as vasa vasorum. And the nerve supply of these blood vessels, they are mainly derived from the autonomic nerves. Okay, so usually the unmyelinated sympathetic fibers, which are usually vasomotor, either vasoconstriction and vasodilatation, and some of the myelinated sensory fibers are also present in the tunica adventitia. Okay, some of the applied aspect of the blood vessels. So arteritis is the inflammation of the artery. Phlebitis is the inflammation of the veins. Atheroma. So atheroma is the a disease of the arteries usually. So here the tunica intima becomes infiltrated with the fat collagen, which narrows the blood vessels. Okay, and hence can block the blood supply to the particular structure and can lead to the infarction. Okay, so the animation shows about the same over here. You can see the collection of plaque there, which gradually narrowing the path of the blood vessel and cause the obstruction of the blood flow. Sometimes this can also lead to the, if the walls are very much weakened, then it may also lead to the dilatation of the blood vessels, which you call as aneurysm, and may rupture eventually. So you can see in this picture, you can see the abdominal aorta, which is dilated over here, or this is called as the aortic aneurysm. And here you can see a small bulge in the brain, blood supply of the brain. One of the most common is Berry's aneurysm. Okay, so here it can mainly classify into true aneurysm and false aneurysm. In true aneurysm, all the three layers of the artery, they become weak and they will be involved in the dilatation. And in the false aneurysm, only one single layer, okay, will be involved, usually of the fibrous tissue. Some of the other applied aspect like acrocinosis and fibromuscular dysplasia, peripheral arterial disease, and one of the most common which you can usually see in the clinic is the Raynaud's syndrome. Okay, Raynaud's syndrome as well as the TAO, thromboangiitis obliterans. So these are the two main diseases, peripheral artery diseases, which you usually find in your clinic. Okay, and artery venous fistula, abnormal connection between the artery and vein. It could be because of some trauma, and usually surgical also it's created in patients who are undergoing dialysis. Okay, and another venous condition like chronic venous insufficiency, where the blood vessels fail to drain the blood, which can eventually lead to edema and skin changes. Usually it happens in the extremities. And one more common condition which we usually see is the varicose veins, which usually affect the superficial veins. And the other condition is the deep venous thrombosis, where the deep veins are involved. One of the primary cause for the pulmonary embolism. So again, one of the most important applied aspect of the veins. Okay. So next is regarding the venous vascular anastomosis. So when you talk about the vascular anastomosis, so we can mainly classify this. Anastomosis means the junction between the two blood vessels. Like we have this synapse, that is junction between the two neurons, or joints, that is junction between the two bones. Similarly, junction between the two blood vessels are called as the anastomosis. So it could be arterial anastomosis, that is junction between the two arteries, or venous anastomosis between the two veins, which is numerous, and arteriovenous anastomosis, a shunt, that is communication between artery and a vein. So when talking about the arterial anastomosis, usually we have this actual and potential arterial anastomosis. We don't have to go much deeper into this, but one of the most important function of the arterial anastomosis is the providing collateral circulation. Suppose if one artery fails to supply a particular structure, then the other artery, it will enlarge and gradually supply that particular area, affected area. Okay, so collateral circulation is much important. Even though heart is one of the most important organ which is going to supply blood to all over the body, unfortunately it doesn't have that much of anastomosis. Okay, so if there is a blockage to one particular artery, the other artery, anastomosing one, it cannot completely nourish the supply. Of course, it may slowly develop collaterals, but you cannot completely say. Okay. So some of the examples for these arterial anastomosis, one of the important which could be frequently asked in the examination and which you have to remember is this one. That is a circle of Willis. Okay, very very important. Remember this. Study about the circle of Willis. And the other one is the arterial arcades. You can see this anastomosis over here. Arterial arcades, right? You can see this anastomosis between the blood vessels of the intestines over here, arterial arcades of the intestine, and around the heart. As I told earlier, you can see the anastomosis of the blood vessels of the heart, and then around the knee. So just try to remember some of the few important arterial anastomosis, okay, so that you can reproduce in the examination as well as in the YOC. Some of the venous anastomosis. So as I told earlier, it is a communication between the veins or tributaries of the veins. Some of the examples are the dorsal venous arch of the hand as well as the foot. Okay, and you can see some of the venous anastomosis that is present near the facial region. But one of the most important, which could be frequently asked in the examination, and you'll find in the clinical exposure, is the portocaval anastomosis. Okay, so this is very very important. So very frequently asked in the examination, which will be helpful for you in future academic year also. So portocaval anastomosis, it is a junction between the portal vein and the systemic veins. Okay, so this is very important because anastomosis is going to happen at multiple areas. So just go through this. It could be asked in the examination. Okay. So these are the multiple levels. Okay. And finally, the arteriovenous anastomosis. The anastomosis between the artery and a vein. Okay. So main functions of the anastomosis, it mainly helps in the collateral circulation. Second, it helps to reduce the heat loss and maintains the temperature of the body. So coming to the applied aspect, as I told earlier, one of the common example for the portocaval anastomosis, in the ascites you will find some of the representations here, like caput medusae, the piles, the hemorrhoids. It could be a result of portal hypertension, and the retroperitoneal anastomosis may also may be resulted in the ascitic conditions, esophageal varices. Okay, so there are certain examples are there. You can go through that. Right. So with this, we come to the end of the cardiovascular system. So here, I didn't discuss about the individual arteries because that will take a lot of time. But my suggestion is, when you study about these blood vessels, always try to understand the origin. Like when you talk about the arteries, learn about from where it starts. Like if you talk about the carotid artery, you know that left carotid artery is starting from the it's a branch of the arch of the aorta, and then you can talk about from where to where it extends, right? And then when we talk about the subclavian artery, we know that it is a continuation of the, it is a branch. Especially I'm talking about the left subclavian artery. It is starting from the aorta, arch of the aorta, and then you will say that from where to where. Okay, and then we'll talk about the axillary artery. Try to mention that it is the one which is a continuation of the subclavian artery. So when you talk about the arteries, so always try to remember the origin and from where to where, what is the extent of the artery. And next, try to remember the branches. Okay, very important. What are the branches? For example, when you talk about the axillary artery, you should remember that axillary artery is having 3 parts, and then the branches, it has got 6 branches. So these kind of things you have to mention when you talk about the branches. This is what NCSM is expecting you to write. So continuation from what is the extent of the arteries, what are the branches of the artery, and where all they are going to supply. Okay, so these are the things which you have to remember when you study about each artery. Okay, one of the most frequently asked question would be like branch of the abdominal aorta, or branch of the thoracic aorta, branch of the arch of the aorta, or what are the branch of the what are the main arteries usually seen in the cubital fossa. So you have to study about these arteries, individual arteries. So when you study about these arteries, try to understand the continuation or their extent. Try to remember the branches and the area where they're going to apply, where they're going to supply. Okay, so this is about the arteries. And so when you talk about the examination point, so you can see that, so this cardiovascular system, along with Sira, Dhamani, and Sotas will be asked for 21 marks. Okay, so the thing is that when you see the NCSM marks distribution, so cardiovascular system carries only 8 marks. Okay, so of course it could be asked for the 5 marks for sure, and of course it could also be asked for the in the MCQs. Okay, so there are chances that it could be asked in multiple ways, but I doubt it could be asked for 10 marks alone. Okay, but anyways, if it is asked for 5 marks, make sure that if it's asked for if the heart is asked, then make sure that you are writing the external features and the internal features. You have to highlight the external features first and then go to the internal features and minimize it. Okay, do not try to explain each and everything. Okay, and there is no need to write about the pericardium. To be specific, if they have asked about the pericardium, write about the pericardium. If they have asked about the heart, write about the heart. Do not try to mix up the things. If they have asked about the heart, do not write about the pericardium. You can just mention it is present in the pericardium, inside the pericardium, but do not mention about the pericardium, the chambers, the sinuses. All those things are not necessary. Okay, if they have asked about the pericardium, you can mention about these things. Okay, there you don't have to mix up with the heart. Okay, right. So this is about the pericardium and heart. Okay, so we'll move to the next topic, that is the Indriya Shareera. Karthik, are you there? So now I want to talk about the Indriya Shareera. Right. Okay, so when you talk about, so I'm so in this presentation I just want to talk about the Ayurvedic aspect of the Indriya Shareera. So I won't be going in detail about these things, but the small introduction. Okay, so Indriya Shareera, so what is Indriya? So Indriya is hello. Okay, fine, thank you. Okay, so when we talk about the Indriyas, so Indriyas are Vishaya Pratidavanti iti Indriyani. So the Indriyas are the one which are moving towards their Vishayas. Some of the definitions which you can remember. So another definition, Inaha Atma, Tasya Sadhanam Indriyam. So Inaha is Atma. So you know that Jnanadikaranam Atma. Atma is the owner. He is the one who deserves to be understood. So Inaha Atma and Tasya Sadhanam, and his tools to get the knowledge are the Indriyas. Okay. So other definition what we give is Inaha Vishaya. So Inaha refers to the Vishayas, and Dhavanti, one which moves towards its Vishayas are the Indriyas. Okay. So here what we have to understand is that the sensory organs are the one which move towards their respective sensory modalities. Okay, so for example, when you talk about the in the next shloka, Sushruta says that इंद्रियाणि इंद्रियार्थं तु स्वं स्वं गृह्णति मानवः नियतं तुल्ययोनित्वात् न अन्योन्यमिति स्थितिः. That means these indriyas, they move towards their respective indriyarthas. Okay, so we have studied about this indriyas. We have panchendriya, jnanendriya. So they move towards their respective indriyarthas. Okay, why? Niyatam tulya unitvat, because of the same origin, they have a similar origin, and that is the reason why they move towards their respective vishayas. So in other words, when you talk about the modern parlance, so there we come across something called as sensory modalities. When they talk about the sensory organs, we talk about the general sensory organ and the special sensory organ. So general sensory organs means the skin, and the special sensory organs, it includes the other four sensory organs like the eyes, ear, nose, tongue. So you can perceive specific sensations from the specific sensory organs. That's why they're called as sensory modalities. That's why they're called as special sensory organs. That's what is highlighted in this shloka. Okay, so indriyas are always anumana gamya. Okay, so that there is a opinion that you so with the help of anumana you can perceive the function of the indriyas. So we will jump that. Okay, so when you talk about the formation of indriyas. Okay, so in Sushil Samhita Sharistana, first chapter, he talks about how the indriyas are formed. Okay, so there he says that with the help of Vaikarika and Taisa Hankara, Ekadasha Indriyas are formed. 11 Indriyas are formed. Among those 11 Indriyas, which can be classified into 5 Jnanendriya, 5 Karmendriya, and 1 Ubhendriya. So when you talk about the Indriya Shareera, first we have to understand that there are 11 Indriyas. Okay, Jnanendriya, Karmendriya, and Ubhendriya. And among these Indriyas, Jnanendriyas are the one which are responsible to perceive and process the sensory information. Okay, so we have these 5 Jnanendriyas, that is Shrotra, ears, Chakshu, eyes, Grana, nose, Jihva, tongue, and Twak, skin. Okay, and when we talk about the Karmendriyas, we have these 5 Karmendriyas, that is Vak, Pani, Pada, Payu, Upastha. Okay, so which are responsible for the physical action and expression. Okay, first Jnanendriyas for perception, sensation, sensory modalities, and the Karmendriyas are for the motor, physical action. Okay, and the mind, Ubhendriya, Manas, that is the one which is Ubhendriya. Okay, which is associated with both sensory as well as the motor activities. Okay, so very important point. And then in this context, in the context of Sharirachana, Indriya Shareera, we have to mainly concentrate on the Pancha Jnanendriyas. Okay, we are mainly talking about the Pancha Jnanendriyas. So under this, we have to understand this Charaka's explanation about Pancha Panchaka, Indriya Pancha Panchaka, which includes the Panchendriyas, okay, Pancha Indriya Dravyas, Panchendriya Adhishtanas, Panchendriya Artha, and Panchendriya Buddhi. Okay, so the same thing he has mentioned in detail, which are those Panchendriyas, which are the Panchendriya Dravyas, which are the Panchendriya Adhishtana, and which are the Panchendriya Artha, and finally, which are the Panchendriya Buddhi, which I have put this in this table. Okay, you can see the which are those Panchendriya, Indriya Dravya, Indriya Adhishtana, Indriya Artha, and Indriya Buddhi. Okay, so in the context of Sharir Rachana, we have to mainly talk about the Indriya Adhishtana. Okay, Adhishtana, Rachana, an entity, a structural visible entity. So obviously, in the context of Sharir Rachana, we will be mainly concentrating on the Indriya Adhisthana. Okay, so in the future slides, I'm going to talk about some of the references which we find about this Indriya Adhishtanas. Okay, so first talking about the Twak Shareera. So Twak Shareera and the Neta Shareera. So for these two, we have ample amount of references. So I advise my students to just go through these two sensory organs predominantly. Okay, for the others, we have some references here and there, but these two have got clear-cut references. So I advise everyone to go through this Twak Shareera and Neta Shareera specifically. So Twak Shareera, so it is derived mainly from Matraja Bhava, remember that. Okay, and Twak Utpatti, How the tvak is formed? According to Sushruta, so during the Shukra Shonita Abhipachyamanasya, so when the Shukra Shonita is undergoing Pachana, so a layer is formed. Similar, he is giving an example. So when you're boiling the milk, as a layer is formed on the top of the milk. Similarly, the skin is formed. And when you see the reference from Ashtanga Hridaya, he says that it is derived from the Asraja. Okay, so Asraja here he means that it is derived from the Rakta. Okay, so Hemadri in his commentary he says that Asrak refers to Rakta. Okay, so we should not think about the Shonita here, like the Shukra Shonita. So I feel it is about is from the Rakta Bhaga only. Okay, from when the Rakta is undergoing Pachana. Okay, then these 7 layers are formed. That is the opinion according to Ashtanga Hridaya. Okay, so layers of tvak. So according to Charaka, so again he has mentioned about 6 layers. So those 6 layers, so only for the first 2 he has given names like Udakadara and Asrikdara, and for the remaining, for the Tritiya, he has classified them based on some of the diseases. Chaturthi again based on some diseases. Panchami again based on some diseases. And for the Shashti, he says that it is the deepest layer, and whenever there is injury to this, the person can goes to may become unconscious. Okay, so that means that we have to understand that it is the deepest layer. Okay, but more clear description is given by Sushruta, which everyone is familiar. Okay, so according to Sushruta, he has mentioned 7 layers. First one is the Avabhasini. Okay, so everyone should be thorough with the name, their specific order, and their function, and especially their pramana. Okay, so everyone should be thorough with these things. Okay, so the first layer is the Avabhasini, and the pramana is about 1/18th of a vrihi. Okay, uh, second one is Lohita, 1/16th of a vrihi. Of course, he has also mentioned about the diseases which affect these particular layers. If you remember them, if you buy at them, it is all the more benefit good, because in the NCS syllabus they have mentioned the structures along with the reptile aspect. So I still advise everyone to remember by the shlokas much better. Okay, if you cannot, at least remember the diseases which affect this layer. Third is the Shweta, 1/12th of Vrihi, and the pramana. What is vrihi? We will discuss about it in the next slide. Okay, and fourth one is tamra, 1/8th of a vrihi, and the disease which affect Vivida Kilasa Kushta. Fifth one is vedini, 1/5th of a vrihi, and the disease which affect Kushta Visarpa Adhishtana. Next we have Shashti Rohini, the equal to the size of a 1 vrihi, and the disease which affect Granthi, Apachya, Dashti, Padagalaganda, etc. And Saptami, the deepest one is the Mamsadara, 2 vrihi, and the disease which affect are Bhagandhara Vidyate Ashwadhishtana. So this is the pramana, and Sushruta has clearly mentioned that this pramana is measured from tan mamsaleshu avakasheshu, from the area which is thick, which has got good amount of mamsa, okay, and good amount of thickness. Only from those areas. Na lalate sukshma anguli adishaja. Not from the areas like lalata or sukshma anguli where you will find very thin skin. Okay, and what is vrihi? According to Sushruta, vrihi means rice grain, and Dalhana says that vrihi refers to 1 yava, that is 1 barley grain. Okay, and he has mentioned further like how to measure this 1/18th or 1/16th. According to Dalhana, he says that you have to cut this 1 yava into 20 equal parts, and then from that 20 parts, 1/18th will be the size of the Avabhasini. Similarly, 1/16th will be the size of the Lohita. So in this, so forth and so on. Okay, so there's a slight difference of opinion in the Dalhana's commentary. Some of the pictures showing about the applied aspect. So this is a chart of the same, the layers mentioned by the different acharyas, Sushruta, Charaka, Vagbhata, okay, and their name. You can just take a screenshot of this same, and you can study this later. Okay, next will be the Netra Shareera. So Netra Shareera, something which you have to remember. So like any other anatomical structure, he has also mentioned clearly about the anatomy of the netra. So first, starting from the netra pramana, you have to remember about the synonyms, because in Ayurveda, synonyms plays a very important role. You can write about the synonyms netra, lochana, nayana, etc. Okay. So netra pramana. So vidya dvayangulam bahulyam. If possible, try to by heart the shlokas. Okay. So vidya dvayangulam bahulyam. What is the measurement? Okay. So uh, he has mentioned. And one more thing about the drishtanta, suvrittam gostanakaram, because here, if you see the YOC pattern of your examination, one of the point is they have asked to keep one particular organ, and they have asked that try to give the drishtanta. Okay, drishtanta. For example, they have mentioned in the example, they have mentioned that you can keep the a model of shukra sperm, or a model of something, and you can give the drishtanta. For example, if they keep the model of a semen or shukra, then you have to write spadikaba, dravasnigdas, similar to that, spadikabam. Okay, similarly, one of the point is they may keep the eye, and they may ask you to give the drishtanta. So you can mention that suvratam gostanakara. Okay, one which resembles like the gostanakara. Okay, and Panchbodhikatva of Netra. So it is made up of 5 Mahabhutas. It could be a question right about the Netra Shareera. There you have to mention about the role of Pancha Mahabhuta in the formation of Netra Budbuda. Like Palam Bhuvo, flesh is made up of Bhu, Agni to Raktam, Agni forms the Rakta, Vatat Krishnam, Krishna Mandala because of Vata, and Sitam Jalat, Sitat Jalam. So the Shukla Mandala is mainly from the Jala Mahabhuta, Akashat Ashrumargascha, so Ashrumarga, the lacrimal apparatus. So that is mainly because of the formed by the Akasha Mahabhuta. So in this way, just try to remember Netrasya Bhaga, parts of the Netra, Mandalani Sandisha, Padalani Lochani, Yathakarma, Vijaniyat, Panchashatya Shadaivacha. So the main parts, you have got Mandalas, Sandhi, Patalas. Mandalas 5 in number, Sandhis 6 in number, and Patalas 6 in number. Okay, try to remember this. What are those mandalas? You have got 5 mandalas: Pakshma, Vartma, Shweta, Krishna, Drishti. Okay, and then there itself he has mentioned about the pramana again of the of this, like the 1/3 of the netra is the Krishna mandala, and Krishna Saptamichanti. 1/7 of Krishna mandala is Drishti mandala. Okay, something which you can again remember. Next, Netra Patala. So Mandala Chandesha Patala Chalochani, Yatakram Vijani, Panchashacha Shadaivacha. So Patala, again it has got 6 Patalas. So they are Tejo Jala Shatam Bahyam. The first one, which is related with the Teja and Jala. You can talk about, you can tell it as Rasa Rakta. And third one is the Pishita Shatam. Third one, which is mainly predominantly of Pishita, that is Mamsa. And Medas Tratiyam Pralashatam. Okay. So third one is mainly predominant with the Medas and Tvasti Chapram. So fourth one is mainly predominant with the Asti and Panch and the last other two, okay, other two patalas are actually the Vartma patalas. If you see in this picture, you can see Tejalashita, Pishita, Medas, Asti, and the last two are the Vartma patalas. That is upper eyelid and lower eyelid. Vartma means patalas. Okay. And sandhis, again we have got 6 sandhis. Okay, those are the Pakshma Vartmagata Sandhi, that is the junction between the Pakshma Mandala and Vartma Mandala, Vartma Shukla Gata between Vartma Mandala and Shukla Mandala, Shukla Krishna Gata between Shukla and Krishna, and the Krishna Drishti Gata between Krishna and Drishti, and the other two, now the last two are Kaninika and Apanga, that is the inner canthus and the outer canthus. These are the sandhis of Netra. And finally, Krishna Mandala, so he has mentioned a specific pramana for that. He has mentioned like it is the measurement of 1 Masoor Dal, okay, green lentil. So Masoor Dal Matram 2, Panchabhuta Prasadam. Drishti Mandala measures about 1 green lentil, Masoor Dal, okay, and it is the essence of all the Pancha Mahabhutas, okay, very important for the perception of vision, okay, Drishti Mandala. And then apart from that, we can also come across some of the appendages of the netra, like Ashrumarga, which is again mentioned. Like when we study about the eye, we also discuss about the lacrimal apparatus. Similarly, when we talk about the netra, so we can discuss about the Ashrumarga, like Ashrumarga, Ashrusotas. They are some of the synonyms. Okay, and pramana. When you talk about the pramana of netra, here they have mentioned like the what is the pramana of distance between the drishti and karna. So they have mentioned chaturangala pramana. So some of the references are there here and there. You get it. And Kaninika. When you talk about the Kaninika, he has mentioned that there are two Akshi Kaninikas are there. Okay. And what is this Kaninika? How you can tell it is the inner canthus? He has mentioned Kaninika Gato Nasa Samipe Avastitaha. So the one, the end of the eye which is near to the Nasa, which is near to the nose, is the Kaninika. And Apanga Sandhi is the one which is Apangayoho Netranta Pradeshayoho. So the one which is present at the outer end of the Netranta, or the one which is present Apango Bru Puchanta Stitaha, one which is present near the tail end of the Bru, that is the Apanga. So you can also add some description about these entities also. Next, coming to the Grana Shareera. So here we will find some references here and there. For example, the Nasa Puta, which we can correlate with the all of the nose, Nasa Guha or Grana Marga, that is the nasal cavity, Nasagra, we can take it as a tip of the nose, Grana, that is the olfactory area. So because he has mentioned Granam Nasaya Vishishta Ekadesho Grana Indriya Adhisthana. So that is Grana is a special area in the nose which is mainly predominant or concerned with the Grana Indriya. So we can take it as the olfactory area. Grana Mula or Nasa Mula, that is the roof of the nasal cavity. We can correlate with that. And then we have some references like Grana Randra, Nasa Vivara. We can correlate with the nostrils, Nasasti, also called as the Ghonasti. Okay, that is the bones, the nasal bones. Okay, so he mentions that there are 3 bones are there in the nose. And when we talk about the Dhamani, so there are 2 Dhamanis which are concerned with the Gandha, carrying the sensation of smell. Okay, Nasa Nadi or Nasika Srotas, some of the reference we get where we can correlate with the nasal myotasis, Nasha Vamsha or Nasasti Dhanda, which we can correlate with the nasal bridge or nasal septum, right? So these are some of the references we find regarding the nose, Nasa. And then we have got Karna. So again, for the Karna, we'll find some of the references here and there, which I have compiled here, like some of the references, Shavana, Shota, Shabdapata, Karnapata, Karnanadi, Karnasota, something which we can correlate with the external auditory meatus, Karnapali or Karnalatika, something which you can correlate with the lobule of the ear, because he has mentioned where you are going to do the Karna Vedana, okay, and then Karna Pitha. So Karna Pitha is the one which you can correlate with the root of the ear, because he has mentioned clearly Karna Pitasya Karna Adho Bhagasya, okay. So we can take it as the root of the ear. And then Karna Putraku, okay, something which we can correlate with the tragus and antitragus. Karna Prishtha, that is the cranial surface of the auricle. Karna Mula, so here we can talk about the area which is present near the parotid region. Why? Because when we study about some of the marmas, okay, like Vidura marma and all, we come across the reference of this Karna Mula. So here we can take it as the near the parotid region, just below the auricle, near the parotid region. Karna Shashkuli, so we can take it as the auricle. And of course, some people try to correlate with the semicircular canals labyrinth, but I prefer to correlate with the auricle because it looks more familiar with that. And Shrota Shringataka. So Shringataka is the one which is more present more in the deeper aspect of the ear. So there I would like to correlate it with the labyrinth. Okay. And Karna Avatu, which you can correlate with the Konka. And finally, the Jihva. So again, in the Jihva, we will find some of the references. One, the main Adhisthana for Rasana, for the taste, as well as it is also a Vagindriya. It is also one of the Karmendriyas, concerned with the production of or alteration of speech. And when we talk about the Utpatti of the Jihva, it is formed by Kapha Shonita Mamsa Sara. So Sara Bhaga of Kapha Shonita and Mamsa, which you can also incorporate when you are going to talk about the Jihva. Jihva is also mentioned as one of the Anga, and in the context of Sevanis, there are 7 Sevanis are there, and one Sevani is present in the Jihva Pradesha. Okay, and he has cautioned us when you're doing the Shastra Karma, you have to be very, very careful. You can avoid this area. Okay, and then Peshi. So when we talk about the Peshi, so ekam jihvaya. So one peshi is present in the jihva. There is a small difference. Is spelling mistake is there. Actually, it is ekam jihvaya. One jihva is present in the one peshi is present in the jihva. And when we talk about the marma, so in the context of marma also we will find some of the references which related with the jiva. For example, whenever some kanta nadi gata marmas, so the marmas which are present in the sira matrika marmas, where when they are affected, like dhamani marma, sira marma, when they are affected, they result in swaravikrita and arasagrahita, absence of taste. Okay, so again, Jihva being the Rasanendriya Adhisthana, so we have to take it into consideration. Okay, one more is the Shringataka Marma, because we have a reference that the siras which are going to do the Santarpana of Jihva, Grana, Shotra, Akshi. Okay, so that conglomeration of those siras is called as Shringataka Marma. So in the context of Shringataka Marma, also we'll find the reference of Jihva. And when we talk about the siras, so there he says that there are 9 siras which are going to supply the tongue. And in some other context, like Dirghaya Lakshana, we will find the qualities of a ideal tongue. Okay, like I am a Vistara Upapanna, Stakshna Tanvi, Pragati Varana Yukta Jiva, how a normal Jiva should be. So these are some of the references which you get about the Ayurvedic aspect of the Indriyas, Indriya Adhishtanas. Okay, so with this we come to the end of the Indriya Shareera. So here I have just highlighted that only the Indriya Adhishtanas and some of the references, important references which you may find useful. Okay, so if you see the marks attributed for the Indriya Shareera here is like 20 marks. So here for sensory organs they have mentioned about 10 marks, and for the remaining they have mentioned about this 20 marks. 4 marks I think for the Kala Shareera, and Indriya and Twacha 3 each. Okay, so they, what I feel is they may club something like in the Shareera they may ask write about the Indriya, define Indriya, classify the Indriyas, and then explain Twacha Shareera. That could be one of the question. Okay, or they may ask purely from the Netra Shareera separately. Okay, so of course, as you can see, it could be asked for the MCQs as well as for the short answers. So you can expect Twacha Shareera and Indriya Shareera for the short answers as well as for the MCQs. Okay, so with this we come to the end of these two presentation. Thank you everyone for patiently listening to almost 1 hour 45 minutes of these slides. So if you have any doubts or clarifications, you can please ask.
Thank you, sir. Thank you so much for taking in such an elaborative session, sir. It's not quite simple thing to take two topics at once, and also you have a sore throat. I can see that. Just a second, sir. I am removing the screen. Yes, sir. Done. That's really um, I can't. I'm not able to express, sir. I'm not able to express the gratitude I have for you now. Despite a bad health condition, you took such an elaborative session, which almost ran up to 2 hours, sir. We are just 1 minute short of 2 hours. Uh, so that's something. You're really now. I'm really inspired by you, sir, because you gave importance to the words that you gave to us, and you have given importance to the work above everything, despite your health conditions. That's something I really want to take away from this session, sir, personally. To work or to be committed towards the cause despite any conditions or circumstances in life. So that I want to take away from you today, sir. So
Thank you so
we will
much.
go for the question and answer. We will go for the question and answer, sir, session, sir.
Yeah.
So I request the viewers to start posting your questions. Sir, I received till that I received few questions on WhatsApp, sir. I will be
Okay.
reading that out to you, sir. Uh,
Okay.
Yes, sir. So the first question is conducting system of heart necessary to study in anatomy?
See, see, anatomy, yes, it is important because at least you should know the structures involved in the conduction system. Like, so where is the SA node? So there could be a question: where is the SA node? Where it is present? Okay, so you should be able to say that it is present at the upper end of the sulcus terminalis. At least you should be in a position to say where it is present. Okay, so of course, studying the conducting system of the heart is important, but from the examination perspective, okay, from the examination perspective, I don't think there may be a question from anatomy, like right about the conduction system of the heart. It could be a question in the physiology, in the Kriya Sharira. But in Rachana Sharira, I don't think it will be asked separately. But of course, from the Vayavosi point of view, it is better if you remember, if you know the conducting system of the heart.
Thank you, sir. The next question is how to remember all branches of aorta?
Ah, that is something. See, when you study about any anatomical structure, first you have to view the structure. Okay, so thing is that by hearting is important. How much ever you say, like, just by hearting, it's not going to benefit you. It is not useful, whatever it may be. But believe me, first you have to by heart. Okay, by hearting is very very essential because it actually makes you familiar with the things. When you are a child, you start by hearting the tables. Two ones are two, two twos are four, two threes, even though you didn't know the meaning of those things, but you just simply by heart it, and then gradually you started understanding that what is two ones are two, what is two twos are four, and all these things. So similarly, when you study about the anatomy, first you by heart. Okay, you by heart, nothing wrong with that. You by heart, and then next see the structures. Okay, so when you see the structures, you get an idea. Okay, so I'm talking about the abdominal aorta. Okay, so abdominal aorta has got three anterior branches, four lateral branches, and five posterior branches. So you just go through that. Okay, so anterior three branches are there. Celiac trunk, I have by hearted that. You can prepare your own mnemonics, or when I was a student, I used to come up with some strange mnemonics so that I can remember them. Of course, I won't write them in the examination, but they certainly help me to remember, to recollect the structures. Okay, so you can come up with your own mnemonics, but by heart them. Okay, and once you by heart, then see the picture, diagrams, very very important thing. Next, see the diagrams, try to understand whatever you by hearted and whatever you are seeing. Next, try to draw the same thing. Okay, so when you do those three things, you by heart. So when you by heart, when you read, so you are stimulating your brain. Next, when you're looking, you are integrating one more sensory organs, eyes. And next, you are doing, you are actually drawing the pictures. So when you do those things, that actually helps to improve the understanding about a particular subject. So it could be branch or it could be anything. My suggestion is follow these three steps. You will easily remember the branches or whatever it may be.
Thank you, sir. The next question is, sir, can
Yeah.
you explain regarding triangle of Koch and what is its clinical importance? Triangle of
Okay.
Koch.
Okay. Triangular coach actually. I mean, see, the thing is that. Uh, just a minute. So it's actually mainly coming from the physiologic, the clinical aspect. I don't think it will be asked in your examination. Minute, because it's actually the boundaries which you have to remember mainly. I'm just trying to show you a picture of that. I'm unable to share the screen. Just a minute. Let me try.
I actually, when we started with the Q&A session, sir, I removed the screen from the stream
Oh, okay, 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 okay.
so that
So, okay.
so that
Actually, okay, okay. So the triangle of Koch is actually mainly present in the right chamber of the heart, right atrium. So usually the main importance of the triangle of Koch is actually when you talk about the clinical aspect. Okay, so it's a small triangular area which is present in the right atrium. If you see the boundaries, it is present between the AV node. Okay, hopefully you are getting the picture. Okay, so AV node, this is the location where you will mainly find the AV node, SA node, AV node. So AV node, the location of the AV node is said to be present in this uh, the triangle of Koch or Koch triangle. Okay, so any problem, any problem with this particular area, this triangular area, Koch area, can be leading to the conduction problems. Okay, the electrical activity of the AV node can interfere whenever there is problem to this Koch triangle. Okay, so that is some of the third aspect. It could be a nice to know question in your VIVOS examination. I'm surely think it may not be asked in the theory examination.
thank you very much, sir. So the next question is conducting system, sorry, sir. Sorry, sir. Yes, sir. Is conducting system of
Yeah,
heart necessary to study in anatomy?
this I think we discussed earlier, right?
Okay, sir. Sorry. The next question is, if heart is asked for 10 marks question, except the four chambers, what all to be included uh, as an answer, sir?
Yeah. Yeah, so what I feel is if I am a evaluator, so what I will be expecting is if it's asked for 10 marks, you have to clearly elaborate the external features, okay, including the boundaries, surfaces, borders, everything, starting from the location, measurement, everything, and then the external features, okay, and then the internal features in detail, and then the blood supply, venous drainage, applied anatomy. So these are the things, these are the this should be the format, okay, which I'll be expecting. Of course, I won't be expecting you to explain about the pericardium. No, not required. Surface marking, not required. Okay, because 10 marks you don't have that much of time. Okay, so for the 10 marks, I strictly believe you just mention about the external features, internal features, blood supply, venous drainage, applied anatomy, nerve supply. That would be more than enough. Conduction system, not required. Of course, you can mention in brief in a single like one para, you can just mention that the conduction system of the heart is from here to here. But whether I'm expecting that, no. If you write it, it's good, but I'm expecting, no.
Thank you so much, sir. So the next question is regarding important diagrams that we know, that we get prepared on this topic, sir, that we need to know, that we
uh,
need to practice
for the
and
cardiovascular, yeah.
yes, sir.
Yeah, so one is just mainly the heart, the anatomical heart. Okay, so very very important thing when you write the examination, draw the anatomical heart, not the physiological heart, the one which you usually draw, while mentioning about the fetal circulation, or when you usually studied in the physiology. So when you talk about, because we are not talking about the circulation here, we are mainly talking about the structure. So we will be expecting you to draw the anatomical heart, right atrium, right ventricle, left ventricle, and on the behind you have got the left atrium. So that is how we will be expecting you to draw the diagram of the heart. Okay, not the one which you draw in physiology, where you draw the two atria up in the upper chambers and two ventricle lower chambers. Okay, so in the anatomy, I prefer draw the anatomical heart. That is one thing. Okay, and if specific is asked, for example, right atrium, if it's asked separately, then you have to, you should be in a position to show like the one which I showed, where I was showing the anterior wall of the atrium, which has got musculopectinetic, crista terminalis, etc., and the interatrial septum, which has got fossa ovalis and the coronary sulcus, sinus opening. So all those things. So it is better if you can highlight those pictures if individual chambers are asked. In general, what I feel is whenever you draw the diagram, try to whenever a question is asked, for example, let's say they have asked about the heart. So when you write about the external features of the heart, when they ask, when you write it has got apex, base, border, surfaces, immediately draw a diagram of a heart and show the
A
apex,
heart
show
and
the
show
base,
the
show the borders. So that will be much better. Okay, so one from how a heart looks from outside, and then any picture which you can draw, like one of the section I showed in the diagram, one section where it shows all the chambers, the right atrium, left atrium, right ventricle, left ventricle. So that kind of picture would be good enough. One which is demonstrating the external features, and one which is demonstrating the internal features. So these two pictures would be good enough.
Thank you so much, sir. The next question is: will there be a chance of 5 marks for the branches, keeping the heart structure as the main important topic?
For theory examination, yes, they may ask. They may ask like write about the blood supply. They may ask one individual artery, and usually they will be asking about the large artery. If they're going to ask for 5 marks, then you have to be thorough with one of the major arteries or major blood vessel. Like it could be the aorta, or it could be the portal vein. Okay, because portal vein is a very very important structure. So they may ask you to write about the portal vein, how it is formed, what are the connections it is going to make. Okay, so yes, of course they may ask these blood vessels, okay, separately. But when you talk about the will there be the chance of 5 marks for the branches? Okay, so they may ask about the branch of any artist. Of course they may ask. Okay, we cannot say outright we cannot say that it won't be asked. There are chances that it may be asked.
Okay, sir. Thank you, sir. The next question is: which question we should expect for surface anatomy?
For surface anatomy.
Yes, sir.
I mean, see, if you see this time when they have framed this question for the OIOC, for the practical examination, so you can see that they have clubbed many things. One is surface marking they have clubbed, and they have clubbed for radiological anatomy, and they also clubbed the marma. So either one of them will be asked. Okay, among those five main questions, there could be one question from marma. So all these won't be asked simultaneously. Like they won't be asking marma, and next question won't be from surface, and other question won't be from radiology. So either one of them will be asked. Okay, so surface marking, they could be usually we have to think about the large organs. Okay, and large blood vessels. So what I feel is usually studying about the large organs which has got some comparison with the ayurvedic perspective. For example, heart, hridaya, pupusa, lungs, amashya, stomach, yakrat, liver. So better to concentrate on those large organs, because usually those are the important organs, and those are the one which are frequently asked, right? The surface anatomy or surface marking of the lungs or surface marking of the liver or surface marking of the heart. So better concentrate on the larger or more prominent organs.
Thank you, sir. I think that is everything from our question and answer session. One last question I would personally like to ask you, sir, with your permission.
Yeah,
Um, yes,
please.
sir. Thank you. Yes, sir. I think now there's only 15 days or less than 2 weeks left for the exam. I mean, almost 2 weeks left for the exam. What one advice you would like to give for the students, for them? to be mentally strong and not to go into like any kind of fear or go through any mental depression regarding exams, because this is a completely new pattern what we have today for them their batch, sir. So certain students are
Correct.
worried more than they actually should be. So what one would advise you should you want to give for them, sir, for them to face the exam bravely, uh, and ignoring all kind of mental dilemma or any kind of thoughts, negative thoughts they have uh, currently, sir. What one
Right.
advice you would like to give?
Right. So yeah. So the thing is that, first of all, don't worry. Okay. The thing is that, it's very easier than said. But the thing is that, see, we have this kind of stress. So we have these two types of stress: useless and distress. So useless is something which actually helps to improve your performance, and distress is something which actually hampers, affects your performance. Usually most of the students, they might have prepared, they are prepared, but usually it is the anxiety, performance anxiety, whether I will perform well, whether I will answer well. So that kind of anxiety will lead to distress, and that will affect their performance. Okay, so you should not be don't get affected by those things. Because I remember, when I was a student, sometimes I used to, when I was under stress, I used to read some shlokas, and because when I before I enter into the Vivos examination hall, we'll be asking with our friends, and they would have told, like, the examiner is asking such kind of shlokas, and I will be like, oh, okay, that is a shloka which I haven't studied. But what happened was, like, I, in that stress, I tried to bahar the shloka, and I baharted the shloka. Of course, once I bahar the shloka, after the examination is over, probably I would have forgotten the shloka. But thing is that that stress actually helped me to improve my performance. So now is the time where you have to use whatever the stress you are having to improve your performance rather than affecting your performance. Just a minute.
Uh, Thanks, sir. And also
Yeah,
the
yeah,
surroundings they have, sir. Like few will be affected by the students. Like if someone tells, "I have read that much, I have read this much." Oh, you are not only completed these topics. Like uh, students get easily tend to get affected by the surrounding people, the surrounding students, their friend circle. So
right,
the amount of
right.
influence they have on them is very much, sir. So how to avoid
Yes.
that
See,
kind
now
of
the thing
things?
is that one of the beauty of this, yeah, so one of the beauty of this NCISM syllabus is, like, everything is structured. Okay, so what I tell you, what I suggest you is, just go to the syllabus. You don't have to study anything extra. See, whatever the extra you have studied. See, now is a time where you have to do the smart study than the hard work. Smart work is essential. Smart, when I say smart work, I mean that you have to study in such a way that if this question is asked in the examination, what I'm going to write. Okay, like, there is a question, you know study about the heart. If the heart is asked for 5 marks, what I'm going to write. If this is asked for 10 marks, what I'm going to write. So make this, idea before itself, and then study accordingly, rather than by hearting, mugging everything. Okay, and then going there and planning. You might have studied everything. You might have studied about the heart. You have studied about the pericardium completely. You have studied about the surface marking. You have studied about the external internal features, blood supply, everything you have studied. And suppose they have asked the exam in the examination. They have asked, write about the anatomy of heart for 5 marks. Okay, then what will you do? Will you start writing everything like the surface marking, pericardium, because only because you have studied? No. So what I suggest you is, now do the opposite way. I mean, that's my personal suggestion. So what I suggest you is, take a topic, read it, and then in the mind itself, just make an assumption. If this question is asked for 5 marks, suppose if they're going to ask srotas for 5 marks, what I'm supposed to write, what are things I need to include. If they are going to ask sira for 5 marks, if they're going to ask sira dhamini srotas together for 10 marks, what are things I have to write. So you have to prepare in that way. Okay, so when you prepare in that way, whatever the influence, outer influence are there, that's not going to affect you. and it should not affect you also. Because see, whatever the preparation you have done, you have done. Okay. Next, there is no use of thinking about the other things. See, the thing is that don't take extra stress thinking that I haven't by heart the shloka. Okay, shlokas are not mandatory. Shlokas, if you write, of course, they may add an impression, okay, because they are like the sutras, the formulas, they will help you to recollect. But believe me, they are not the only thing. Even if you know the meaning of the shlokas, they are equally beneficial. But my sincere suggestion is when you write this, especially I'm talking about the Ayurvedic part, try to use the Ayurvedic term as much as possible instead of translated terms. Okay, if you're writing about the, let us say, Mrta Samshodhan Shareera, write the same words, Misrishta Antra Mutra Purisham, instead of writing, removing the fecal matter and Purisha Mutra, everything. So instead of writing that, try to use the Ayurvedic terms only. Bala, Valkala, Kurcha. So such terms. So whenever you're using Ayurvedic topic, try to use the Ayurvedic terms. So don't be stressed thinking that I haven't bahated the shloka. Okay, don't worry about that, because at the end moment, what matters is the presentation. How much ever whatever you have studied, how you are going to present in the examination, that plays a very important role. Okay, so you might have studied something, but when you present it wonderfully, it plays a very important role. Okay, so don't think that just by mugging up and remembering everything will help you to pass the examination. Presentation plays a very important role. So time management, manage the time, try to understand if this question is asked for 5 marks, how should I present that answer. Okay, and accordingly prepare for your examination, so that you should not be affected by any kind of stress.
Thank you, sir. And one last question, sir. We
Yeah,
have also, this is the whole thing. Our series was concentrated on RS7 batch students, sir. But there's
correct,
also a few people who have backlogs in anatomy. The students from RS6 and RS5. Uh, as of now, they would have attempted multiple times, like almost two to three, at least of 2 to 3 times. But uh,
correct,
due to some circumstances, due to some or the other factors, they are not able to clear off their papers, anatomy papers. So, what would you like to
yes.
suggest them to clear their papers in this attempt, sir?
Yeah, so don't get disheartened. So my suggestion is, there is no use of getting disheartened. Okay, because that won't help you to pass the examination. The thing is that, I mean, there are these are old things like failure is a stepson for success and all those things. But thing is that once you failed, what are the remedial steps you have taken? That is the most important thing. See, there, as Mr. Karthik told, there could be many circumstances, unfortunate circumstances where you might have failed. But the thing is that by this time you should have assessed, like, what is the main reason that I failed. Was there any problem with my presentation, or was there any problem with the preparation? So the thing is that now, since you have failed, see, now we cannot undo that. Okay, now the thing is that there is no use of thinking about the past and spoiling your future. Now my suggestion is, think about the future, think and plan how to study, because your this one is different. The question paper what you're going to get is different. Okay, and the syllabus distribution was different. So but the one which I told, like how to study, the method of study, that smart work, that is something which I will suggest you now also. Okay, so there could be some problem with the presentation. Just concentrate on your presentation techniques. Okay, why you are not getting the complete marks? My suggestion is, like, most, when I say presentation technique, usually most of the students, what they do is, when they're writing the answer, they write one page, and then they forget something, and they leave that particular space, and they say that, and they think that they will come back and write, fill that space later. But what happens is that uh, by the time they finish the examination, they would have forgotten it, or they didn't really recollect the thing. But thing is that the blank space is still there, right? So when the evaluator is evaluating, it is like, yes, see, I have forgotten something and I've left the space. Just observe this. It's an invitation for the evaluator to put negative marks, right? So thing is that don't do such foolish things. If you know the things, write it down, and don't leave the space in between. Okay, try to fill them at the last. Okay, at the last, so that even if you have done some mistake, you can feel that later. Okay, and if something is there, even the examiner evaluate anyways, he will find out if there is some problem with that. But the thing is that do not leave those blank spaces, because it will affect your presentation. They will look bad. And always try to draw the diagram. Diagrams are self-explanatory, and draw the relevant diagrams. That is very, very important. Okay, so some people, they try to draw the urinary system, and they end up drawing the reproductive system. So draw the relevant diagrams. Very, very important.
Thank you, sir. Thank you so much, sir. Thanks for
Yeah.
answering all the personal questions I asked to, sir. Thanks for that. And I, on behalf of my whole team at Jignasa, would like it's, thanking is not enough, sir. That's what I feel. We are really grateful to you, and we have immense gratitude for whatever you did today, sir. We're really, really
It's a
grateful for
great
you
work,
for that.
Karthik. It's a great work. Keep up the good work. Come up with such good things in future.
Yes,
It's a motivation for all the students also. It's a great work done by the Jignasa. Congratulations once again.
thank you, sir. Thank you, sir. Thank you for really appreciating us, sir. That's what things like this makes us happy at end of the day, sir. Because despite our academic schedule, we are trying our best to give our juniors to help in their exams. Since this is a completely a new schedule, new scheme for us, for them. I met many juniors in my own college who were pretty confused with what's going on, what's the updates, what's the blueprint, kind of questions papers may come, like that. So we planned these sessions from almost 2 months, sir. We wrote, I mean, my team wrote every question, every topics notes covering by sitting daily. They didn't copy from Google. They didn't refer any PDF or PPTs, sir. They sat down. They referred books. They referred samhitas and made the best notes possible, sir. Drawing flow charts, tables, and everything. And lecture series. Um, um, there are my two teammates who are namely Priyanka and Shibu, who are really helping me a lot in doing executing everything in of higher anatomy, particularly this higher anatomy live sessions, be it making posters, be it in promotions, everything. The team of three, like they are helping a lot and they are giving their best too. So on, I would like to thank them also through this session. And personally, sir, I really, really thank you so much for agreeing to host the session. And you took a session for almost 2 hours 30 minutes, sir. And this is our longest session on iron anatomy. Despite you are not feeling well, that's some dedication, sir. I completely mean it. That's some dedication. And going through your CV, I don't know how, I literally felt proud reading that I am going to host you today, like a person who has achieved so much in his career. And after listening to you for 2 hours 30 minutes, despite whatever the conditions you had, I really moved by this, sir. I'm literally speaking from my heart, sir. I'm really moved by this, sir. And I would like
Thank
to
you.
announce one thing through our live session, sir. We hadn't made this public so far. We are planning for a magazine and working on it from one past 1 month, and we have drafted the magazine, sir, and the draft is ready now. We haven't
Okay.
made any public announcement so far, but I think this is the right time and right session, and I am with the right person to do that. So we are bringing a magazine, we're bringing up a magazine called Ayur, sir, and I request
Super.
your support for that, sir, and I request your support for that, sir. It would really mean a lot
Of course, of
if
course.
you if
Not
you
only me,
support for
even
that,
my
sir.
students will be there to support you. Yes, of course, of course.
Thank Thank you,
It's
sir.
an
Thank
honor.
you, sir.
Yeah,
Thank you, sir. That really means a lot, sir.
sure, sure.
And once again, on behalf of the whole Jignasa organization, I would like to thank you, sir.
Thank you so much. Thank you so much. Thank you to Karthik and your team, for the whole Jignasa team. Thank you so much. You're doing a great work. Keep up the good work, and you'll get the you will reap reap the benefits of it.
Thank you, sir. Thank you, sir. Now I request your permission to end the session, sir.
Yeah, please. Thank you.
Thank you, sir. And thank you, viewers, for your patience to listening for almost 2.5 hours straight. That was really actually thing that moves us like to keep doing more things for you. Thank you for that same dedication you have been showing from day one. Join us for two more sessions tomorrow. um, keep studying, guys, and rock the exams. Thank you, guys. Thank you for joining. Thank you, sir, again.